Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Prerequisites of intrauterine before intrauterine insemination. The prerequisites before intrauterine insemination include the sperm concentration should be at least more than or equal to 10 million per ml. Sperm morphology should be at least 14% of normal. Indications of intrauterine insemination. Intrauterine insemination is done if the male has any ejaculatory problems or in presence of hypospadias, epispadias, or any retrograde ejaculation. In these conditions, we can do intrauterine insemination. If the male has neurogenic impotence or if the male has oligospermia but the sperm count is present between 10 to 15 million per ml, if the male partner has a hereditary disease where there is risk of transferring the disease to the offspring, in this case we go to intrauterine insemination donor. If in female cervix anti-sperm antibodies are present or if the female has vaginismus. So in all these conditions we can do intrauterine insemination.
thank you and thank you for watching.